I'm Max Modril, and this is my Grip Gains occupation-based kit and PICO presentation. This is based off of a client who is a 21-year-old female who sustained a distal radius fracture from falling on an outstretched hand during one of her softball practices. This was repaired about 3 weeks ago using an open reduction surgery method, and now she's currently in a splint. Because she's an athlete at the university, she's receiving therapy in the athletic training facility. She is a education major and is also on the university's softball team. Due to her distal radius fracture, some of her important deficits are a decreased range of motion, strength, dexterity, manipulation, coordination, among other things within digits 1 through 5 of her affected right hand and wrist. Because of these deficits, it leads to many functional limitations, basically all occupations that require her right hand, but most important to her are not being able to participate in softball workouts and practices, as well as not being able to complete her school assignments because of her inability to handwrite. So based off of that client scenario, I came up with a PICO question of, among patients with a distal radius fracture, is early mobilization exercise effective in improving handwriting skills? So based off that question, I went into the literature and I found 3 level 1 studies that were systematic reviews, 2 randomized control trial level 2 studies, as well as 2 quasi-experimental level 3 studies. From these 7 different studies that resulted in a sample population of about 1,500 individuals who all sustained distal radius fractures. In all 7 of the studies, the outcomes that they measured had to do with range of motion, strength, and functionality within that right wrist and hand region. And in all 7 studies, the results showed that the experimental group receiving the early mobilization exercises all had improvements in range of motion and strength of their affected extremity. Based off of those findings, I concluded that the answer to my PICO question is yes, early mobilization exercises to individuals with a distal radius fracture would improve their ability to do handwriting. This is because having increased strength and range of motion within that affected hand is going to lead to increased endurance, coordination, dexterity, and manipulation skills within those digits, all of which are going to be required to do handwriting. So now, just sort of moving into my kit here, I'm taking the evidence from my literature review and incorporating it into this kit that you see here. I chose this kit with all these different games because my individual talked to me many times about how her family and her friends have game nights, so this kit therefore is very meaningful to her. And by implementing this kit, there's many different ways and different games. So basically, she can pick what game she would want to play, and then the therapist or I would modify the game with the pieces to make sure that she's working on those correct wrist and hand range of motion exercises, as well as different prehension patterns and manipulation skills that are going to be required for her to improve those client factors to be able to do handwriting. Thank you.